Mir, when is the normal delivery suggested and when is a cesarean section suggested by a gynec?
So very nice question. Normal delivery. I think nowadays the whole community is looking at obstetricians, and they are now feeling that obstetricians are doing more and more cesarean sections.
Right.
We get reports in the papers about WHO, the World Health Organization, trying to curb the incidence of cesarean sections. So, as I said earlier, that the aim of obstetric care is a healthy mother and a healthy baby at the end of the 9 months.
Right.
The mode of delivery is not in the hands of doctor.
Right.
We have patients who come to us in the first 3 months and they say, "Doctor, आप normal delivery करोगे क्या?" I think only God will know whether that delivery is going to occur normally or not, because pregnancy itself is a dynamic process.
Right.
And labor is still dynamic.
Sure.
As obstetricians nowadays, we have stopped using the term normal delivery. What normal delivery essentially means that the delivery occurs in the vaginal route.
Right.
Now, to have a delivery in the vaginal route, there are a lot of preconditions required. The baby has to be healthy. There should be adequate liquor. The position should be conducive. The maternal canal should be roomy. And the whole process of labor should be uneventful without any problem to the mother and the baby. And then what we deliver vaginally is called a vaginal delivery.
Sure.
Sometimes the woman can have problem in the last stage, that is the second stage, to bear down,
Right.
wherein we can aid the delivery with an instrument like a forceps or a vacuum,
Sure.
which we call an instrument vaginal delivery.
Right.
And suppose these conditions are not met, then we resort to something called cesarean section,
Okay.
where we resort to opening the layers of abdomen and delivering the baby from the abdominal route.
Right.
The misconception is that doctors are doing cesarean sections for the sake of money.
Right.
That should not be the case, and because of that misconception, nowadays at many places the rates are almost comparable with a normal delivery, which is called a vaginal delivery, a instrumental delivery, or a cesarean section.
Okay.
That particular bias or the apprehension of the patient is taken care of.
Okay.
Now, why these cesarean section rates are increasing, that the audience should know.
Sure.
Our anatomical teacher used to tell us, when he used to teach us anatomy, that is our first MBBS class,
Right.
that the cesarean section is a curse to humans because of the erect posture.
Okay.
Have you ever heard any elephant undergoing cesarean section, or a giraffe or a zebra?
Right.
None of the animal kingdom there is cesarean section, because they walk on 4 legs.
Sure.
We are the only species of mammals who walk on 2 legs.
Right.
And our upper extremities have become hands, which are more functional. Also, we are the intelligent species, so our brain size is bigger. As the development has occurred in the last 3 decades since I am there, in 1994 I started my OBGYN training at KEM and Wadia, which is one of the prestigious institutions.
Right.
And now in 2024, we are finishing 2024, almost 30 years.
Sure.
Each decade I have seen the cesarean section rates increasing.
Okay.
This is because the activity of the woman is reducing. Earlier times they used to squat, do all the exercises, they used to do household work,
Right.
by sweating and then cleaning the
Floor.
tiles, floors. Or they used to make buttermilk with holding the utensil between the 2 legs and then doing it.
Right.
These are our now exercises which we teach them, and we have to start doing it from the second month of pregnancy,
Sure.
so that those muscles are accustomed.
Right.
Breathing techniques have to be improved. Then the generations are more active.
Right.
So what happens is, when they are moving constantly inside the womb, the cord gets entangled around the neck, and then they have a typical deflex position during delivery, or the cord becomes tight and the heartbeats drop.
Okay.
Other things are, more and more elderly patients are becoming pregnant, so they have comorbid conditions like hypertension, diabetes, any heart problems. Because of IVF, there can be twin pregnancies. So one baby is head up, other baby can be opposite side breech. They can get mixed, entangled between each other. It's called locking of the breech. The position of the babies can be transverse lie or breech. So we can for sure tell in the last sonography that these patients are going to require cesarean section. That means the baby is breech or transverse, or the placenta is low lying, or there is a medical condition, or there is a previous cesarean section or previous myomectomy scar on the uterus. The uterus may just rupture during pregnancy. As in the twins, if the first twin is breech. So those conditions we tell them that you are going to require cesarean section for sure. Anything else, if all these factors are ruled out, as a healthy baby, we can always try a vaginal delivery, and that should be the preferred route.
Right.
The new generation is having apprehension of the pain, and they are going to be able to bear the pain or not. We all know the Three Idiots vacuum scene, and the baby was not crying immediately after birth, and the mother was exhausted.
Right.
So that has, it is a good scene, very nicely, very well depicted. So nowadays we get, वो pain नहीं मांगता है, Three Idiots जैसा, और baby तुरंत रोना मांगता है. The woman itself asks for cesarean sections.
Right.
But we have something called epidural analgesia. In the active pain labels, the active labor starts, the pains are more severe. We give called the anesthetist, and they give a injection in the spine, in the epidural space, where we put a catheter.
Okay.
And we can give top-up doses that time. So the pains will continue, but the woman in labor will not experience the pain.
Okay.
The advantage additionally is the labor progresses fast,
Right.
and it is painless.
Sure.
Only disadvantage is sometimes the bearing down sensation which is required for the last stage, just to push the baby out, which was shown in that movie also,
Right.
is difficult,
Okay.
because the woman's those motor systems also slightly sometimes compromised.
Sure.
So we may require additional help of vacuum, which was shown in that movie,
Right.
or forceps.
Right.
Now, if it's not applied properly, the baby can have certain problems, and that has, or the mother can have genital tract trauma.
Sure.
That has caused fear, and with the past experience, sometimes a lady tells us, "Ki avoid vacuum forceps completely." But one should not be dogmatic about that, because sometimes during a cesarean section also we apply vacuum forceps. These are time-tested instruments to aid the obstetrician in a healthy delivery of the baby.
Sure.
In fact, if I have to do a cesarean section for a preterm breech, I use something called a cage forceps. Means the preterm baby's head is very narrow, and there is a high chance of an intraventricular bleed. So during a cesarean section, I apply forceps voluntarily so that the baby's head is protected gently, and it comes out gently with the forceps
Okay.
during a cesarean section, and this is a very acceptable technique.